Robert T. Muller, PhD, trained in Harvard, was on faculty at the University of Massachusetts and is currently at York University in Toronto. Dr. Muller is a fellow of the International Society for the Study of Trauma and Dissociation. For his work on trauma treatment, his newest therapy book, Trauma and the Struggle to Open Up, was awarded the 2019 ISSTD Award for the year's best written work on trauma. And his award-winning bestseller, Trauma and Avoidant Client, has been translated widely. As lead investigation on several multi-site programs to treat interpersonal trauma, Dr. Muller has lectured internationally, Australia, UK, Europe, USA, and has been keynote speaker at mental health conferences in New Zealand and Canada. He founded an online magazine, the Trauma and Mental Health Report, that is now visited by over 100,000 readers a year. With over 30 years in the field, he practices in Toronto. And thank you very much.
Thank you so much. The title of the talk is when the therapeutic relationship or the trauma psychotherapy relationship goes off the rails, countertransference and relational ruptures in trauma work. But before I start, let me give a little bit of background about myself, I think, just to so you have a sense of kind of who where I'm coming from. So my parents were children during the Holocaust. I grew up, I'm a child of Hungarian Jewish immigrants to Canada. And in fact, a year ago, I published my parents' memoirs. So in a book called From Hungary to Canada, The Memoirs of Louis and Eva Muller. My dad and mom sat down with me when they were in their 70s, and I did hours of recording and put it together, edited it as their memoirs. And it's very interesting because as children during the Holocaust, their experiences were very unique, of course. I mean, everybody's experiences are unique, and I don't think, I don't want to prioritize one over the other. What their experiences were, in many ways, were experiences of confusion, experiences of, seeing their parents being overwhelmed and frightened and terrified and trying to hold it together. My mom was actually separated for about 9 months. So they were in Hungary, and the Nazi Party was really only was in Hungary for about 9 months. But in that 9 months, they did tremendous damage, of course, and my mom very nearly was killed several times. My father's father was murdered. And so after the war, my dad, who was 10 years old, so my mom was 7, my dad was 10, he had to learn a trade, and he had to, so he became an upholsterer at age 11, 12, and had to support his family, which was his mom and his sister. So in many ways, I come to this story of trauma and to understanding it through the lens of two people who in many ways lost their childhoods. Like that was a big thing that I think I grew up with. There were a lot of stories of the Holocaust when I grew up. My parents were not. There's an author named Rachel Sofer who's a psychoanalyst in New York, and she wrote a piece in the New York Times about her grandfather who went through the Holocaust and kind of the secrecy and the silence. And although I've written a lot about that in my book, in this book, Trauma and the Struggle to Open Up, although I've written a lot about it, my experience was a little bit different in that my parents talked about it a lot. But I think those stories of the Holocaust, stories of being children, stories of what the aftermath for my mother her experiences after the Holocaust, growing up in Hungary from 1946 on. So she was born in 1937. She's still alive. My dad passed away a couple of years ago, but my mom is still alive. In 1946, her parents had to sort of pick up so her family, bizarre coincidence that no one in her immediate family was killed. It was just because most people did lose. So just by strange coincidence and luck, or whatever you want to call it, random chance, lots of things, who knows, her parents both were alive after the Holocaust, and but their relationship with each other was so damaged, and their sense of intimacy, their sense of family. So she struggled, like when I was a kid, she struggled with how to build a family, how to be a mother, how to be a wife. And she talks about this in her memoir, kind of what kind of struggle that was. So I kind of grew up. Now, if you would have asked me when I was in graduate school, why am I interested in this topic, I would never have said it's because of my family, my parents. I did go through a lot of therapy, but I never made the connection. It was really only in my 40s, when I already had kids of my own and they were little kids growing up, that I started to make this connection, that really it's fundamentally because of what I grew up with and my, seeing stories of the Holocaust that my parents went through that have really shaped my thinking, my life, my therapeutic work afterwards, and all of that. Hi. So that's the background I come with, and yeah, no problem. I'm happy to. So a lot of the material I'll be talking about is found in this book, Trauma and the Struggle to Open Up, which I published a few years ago. It's a 2018 book, In my work, so much of my work is relational, and Trauma and the Struggle to Open Up really is about a relational approach to psychotherapy. It's integrative, integrating psychodynamic and more and other emotion-focused kind of techniques. What is so fundamental in doing relational work is navigating your countertransference. And therapists who work with trauma survivors very often really struggle because of the many feelings that trauma raises in us. And many of these feelings are based on our own attachment history. And so, as I said, in the example that I gave around myself and growing up, I would say in many ways my father tends toward a dismissive or avoidant kind of attachment. My mother tends toward an anxious attachment. And a lot of that work I came to understand much better, or a lot of how that impacted me, I came to understand much better in my own psychotherapy that I went through as a graduate student and doing my postdoc. But it's really important for all of us as therapists to think about what our own attachment history is, and how has the attachment pattern that we were, let's say, raised with and that we have come to identify with, how that has impacted us. In practical terms, this means really recognizing the difference between feeling our feelings and acting on our feelings. And so I will give some examples through this workshop around that distinction. The first piece of it, which is feeling our feelings, really is about noticing countertransference. And when I say noticing, what I really mean is paying attention to our countertransference. And of course, much of what I'll say, I think, I would imagine this is not news to you. Of course we need to notice our countertransference. No kidding. I mean, why wouldn't we want to notice it? The thing is, when we're triggered and when something comes up that has really impacted when our attachment system is activated, it's really hard to fail to notice our own countertransference. So I normally would give a self-reflective exercise here, but I'm not going to, and the reason is because in the interest of time, and I know there are several people who need to still check out, so I want to be able to time this so that we end by 10 to 11. So what I'm going to do is so all of you have access to the slides. And I'm going to ask you to do this at home. You know, sometimes you have that, do not do this.
Are they in the box over there?
I don't know. Are there slides? Did folks not get slides electronically?
No, they print it out.
I sent it to Alice, but I don't know.
They're here.
They're either there? Oh, you have slides. Okay.
They print it out. It's paper.
Is there a way to get them electronically?
You can ask Alice, the conference coordinator. I can send it to you if you email me, if you like. Yeah, no problem. Please, yeah. But if you like them electronically, I'm happy to, you know what? My email address is at the end of the slides. If you would like an electronic copy, I'm happy to send you one. Just email me, and I'll happily send you a copy. You think we have enough time? All right, let's do it. So let's take 5 minutes, and I'm going to ask you to do is a self-reflective exercise that activates your attachment system. Think of a specific time, and what I'm going to ask you to do is to think of not a mix of times, not all those times where you felt scared or a theme of times, not that. Not like those times where you felt rejected in general, no. Think of an autobiographical memory, a specific episode in your life, in your real lived experience. You know, when I was in grade 3, I remember this teacher who bullied me, and on this one particular occasion, she said such and such, and I felt really, so that sort of thing. Think of a specific occasion and from your actual lived experience. That's how we activate the attachment system. That's when clients get activated the most, is when they're specific memories. Specific memories have specific emotions attached to them. So think of a time specifically where, you know, these are some markers of an attachment, a time when your attachment system was activated. In a relational context, you were either shut down emotionally or out of control emotionally, or your feelings were overwhelming to you. Okay, so think of a specific time. I'm not going to ask you to share this with the group. This is not a group therapy exercise. So I'm going to ask this as a totally private. Take a pencil, look on the back of one of those pieces of paper, and just write what you were thinking and feeling in that situation. Think about what part of you was activated. So if you think about parts of self, what aspect of yourself was activated? And how do you think this story of your life has had an impact on you? So just take 5 minutes.
How do you think has that an impact on you now?
Yes. How has this childhood experience or developmental experience or experience earlier in your life impacted your adult development, let's say, or your later development in life? If you can, yeah. I mean, I'll let you interpret that. Aspect of you, however you want to, without getting too, okay? I'll let you interpret that. All right. So let's just 5 minutes, and then I'll ask you another question.
While you were talking, I did all the 5 minutes.
Okay.
And I got to a new realization. It's interesting.
Okay. Okay, so just another minute, and then... Okay, so now that you've sort of had a moment there to self-reflect, I'd like you to just write down, again, just write, any feelings that you noticed were activated during this exercise, any emotions at all. Just notice, pay attention, and just write them down. I'm not going to ask you to share it with anybody. Okay, so I promise I will take up questions in a bit, but give me a moment to build towards something here. Why did I ask you to engage in this exercise? Because countertransference raises feelings in us and becoming increasingly aware of the kinds of emotions that tend to get triggered when we think about our own vulnerabilities, when we think about our own attachment histories. These are emotions that will come up, sneak up on us, and throw us into some kind of enactment with clients. Most of the time, it's unwittingly. It's something that we get triggered when we're not even realizing it. And so it's helpful to think about, as I mentioned, noticing countertransference, the distinction between feeling and acting on, and also thinking about our own attachment patterns is necessary, because when we act on our countertransference, it's because of what David Wallen talks about in his book Attachment in Psychotherapy. He says that enactments happen most often when client attachment patterns interlock with therapist attachment patterns. And I'll give you some examples here where what happens, something has been triggered in us, and we then end up acting on our feelings. So let's take a look at some examples, particularly in, again, we're talking about trauma work here. Let's look at some countertransference patterns that are very common, especially with trauma clients. Countertransference patterns reenact trauma dynamics within the psychotherapy relationship. And so when I say trauma dynamics, think about if you're working with trauma clients, whatever, this is why I share it to some extent, my understanding of what brought me to the field of trauma, really paying attention to and taking stock of what brought you to the field of trauma. What was it specifically in your life? And when I say specifically, I really mean thinking about those autobiographical memories that raise feelings. Feelings that, or stories that, or memories that even some of your closest friends might not know. Maybe your partner knows, maybe not. Your husband or wife knows, maybe not. Maybe your best friend knows, maybe not. Maybe your therapist, maybe this is something you haven't even told your therapist. But what are the dynamics that really brought you to the field? Stephen Karpman talked about the victim, perpetrator, rescuer triangle. And this triangle, victim, perpetrator, rescuer, is a really good model that helps us think about countertransference patterns. And I say common patterns. When I say patterns, I mean patterns we fall into, we stumble into. Again, because unconsciously something has been triggered in us, something has been triggered in the client, and then we go down the road of something that may lead to an enactment. After our break today, I will specifically go into a few examples of actual enactments that are really problematic, where the relationship really struggles, goes off the rails, and how do you get a relationship back on track when it has been thrown off track. And so that's what we'll look at specifically after the break. Before the break, we're going to look at common countertransference patterns. So the stuff before the break, before 10 to 11, is going to really look at patterns that are very common. Then after the break, we're going to look at, despite a therapist, me, knowing those patterns, how did, in some of the examples I will give, how does the therapist stumble into an enactment, the relationship goes off the rails, there's a rupture, and then you need to actually get the relationship back on track. How do you do that? So we will look at that after the break. So those are the two parts. So let's first look at countertransference patterns. And probably the most common pattern that's talked about in the literature is the rescue fantasy. And in this pattern, what we see is the therapist as rescuer, client as victim. Now you notice I have it in quotation marks. Why do I have it in quotation marks? Because it's as if the therapist is rescuing. You're not actually setting out to rescue the client in this situation. And the client isn't setting out to be a victim. But here we are, we're in a situation as therapist and client where this is what we're acting out. In this case, the therapist over-identifies with the client as a victim. So what does this look like? We see the rescue fantasy in cases where the therapist works really hard to try to fix the client. Think about what I mean by fix the client. When we say fix somebody, who needs fixing? Or what needs fixing? Something that's broken, right? And so it's as if this person is this broken individual who can't do things for themselves. When this happens, when a therapist is in the space where they're trying really hard to fix this person, what you want to really pay attention to is your affect. So what is your emotional stance toward the client in that situation? What are you doing in your body? Is your blood pressure a little bit up? Is your heart rate a little bit up? The client has just said something to you, maybe something about suicide, maybe something about a dangerous situation. The client might tell you about a domestic situation that might be dangerous, and you're all of a sudden sitting forward in your chair. What's your body language doing? You're sitting forward in your chair. You're pulling out the suicide or the safety contract that you contracted for a few months ago. Your nonverbal behavior is a little bit more tense. You're shaking. You're telling the client what to do. Well, wait a minute, Kelly, you really can't just leave your kids at home with your husband babysitting when you told me that blah, 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 and you're now telling Kelly what to do. I'm not saying that that's wrong necessarily, but notice yourself engaging in that kind of dynamic. The client is engaging in a kind of dynamic where they're letting you tell them what to do. I sometimes call this, in my book, I call this the guru enactment. Have you ever noticed yourself behaving a little bit like a guru? Where you're doing, and you justify it to yourself. Well, I'm just doing psychoeducation with this person. And the person, Dr. Muller, what do you think I should do? My boyfriend did this. Do you think I should break up with him? Well, I think that, and you start getting into, I think that, or why don't you do this, or telling the person what to do. And week after week, the same client is the one who's coming to you, seeking your brilliant, wonderful, smart advice. If you find yourself feeling as if you're so smart with this client, feeling as if you're really needed by this client, feeling as if, this client, before I came into, I've heard therapists say this, who I supervise, I've kept Kelly alive for 20 years. If it wasn't for me, when you find, and it might be true, that may not be wrong. Maybe you did, actually. Maybe you did keep Kelly out of the hospital. But notice the fact that you're saying it. What does that say about you and how you feel toward Kelly? What does it say about you and any of the background you come in with? is this dynamic reenacting some kind of unmet needs in you and some kind of unmet needs in the client? Are the unmet needs in Kelly a wish to be with someone who's smart, nice, helpful, caring, all those things? Are the unmet needs in you to be needed, to be seen as smart, to be seen as helpful, to feel like you're important in some way to somebody? Those are some of the things you want to pay attention to if there's some risk of you stumbling into this guru enactment. This I see a lot with trying to fix the client. Telling the client what to do, telling the client to stop seeing their abusive partner. Marianne, I understand that Kyle brought you flowers and Kyle apologized, but we've been through this several times. You really ought not to keep dating someone who is hurting you. Now again, that may be in fact the right thing to say once or twice, maybe even 3 or 4 times. But if you find that you've told Marianne that 16 times, and Marianne keeps going back, I will say that if you pressure people, or if they feel themselves to be pressured, or if they experience themselves as being disempowered, it is so much easier for a client to leave a therapist than for them to leave their abusive partner. Right? I mean, like, you are much more dispensable than the abusive partner. Now, again, this puts you into a conundrum to say, well, then what do you expect me to do? Like, I mean, this person seeing this is a dangerous situation. I'm not telling you what to do. In fact, it might be a dangerous situation, and you might need to react in certain ways that are appropriate to that. I'm just bringing in these situations that cut on the edge and create some sort of question for you as to whether or not is what you're doing. So these are questions to ask yourself. Am I actually helping this client, or am I disempowering her by becoming that strong voice that she can't have herself, or am I helping her find her voice? And it's a delicate balance. And the work with countertransference is always about asking yourself questions. What am I doing here? Is this appropriate? Have I crossed away from psychotherapy into becoming this person's guru? So that would be a question I would ask. That very often happens with the rescue fantasy. And again, there's nothing wrong with that. In part, we are there to help our clients. We are there to sort of, these people are coming in vulnerable, struggling, they want help, and we're offering it to them. So is there a little bit of rescuing going on? Of course there is. But it's just about the balance, right? So that's, and in that situation where you stumble into a full-on enactment, a guru enactment, you're playing the role of rescuer, client is playing the role of victim. Yes, question.
I just wanted to just comment, the other part of that is, in particular in abusive situations, is that you can also unwittingly do the same thing that their abuser is doing, which is telling them what to do,
Yeah.
being in charge, and you're not allowing them to have roles.
100%.
It's hard to watch somebody really in a place that's abusive and struggling and suffering, but
Yeah.
they're doing the same thing, and not giving them the biggest thing you can do is to be able to talk about, well, what does it
Yeah.
look like if you stay? What does it look like if you go?
Right.
What are the parameters around safety?
Yeah.
And giving them that voice.
Exactly. And it gets even more, I 100% agree. And then it gets even more complicated when we think about like trauma theory. Judith Herman, in her book Trauma and Recovery, it's a 1993 book that inspired, really a whole generation of trauma therapists. I was doing my postdoc when that book came out, and I read it and it was like, oh, okay, this is the field for me. This is what I want to do. She talks about a moral commitment to truth-telling. And so, if you take that ideal far, then aren't you, by saying to this person over and over again, you really should leave your partner, aren't you just truth-telling? Well, Maybe, but then there's also this other dynamic, which is about empowering people. And so finding that balance can be really hard. It can be really, really challenging. Okay, with the rescue fantasy, there's some other dynamics there. It's not always about fixing the person in that same sense that I mentioned before. Sometimes it's about indulging the person. Why? Because you feel sorry for them. If you find yourself doing special rules for one client or the other, excuse me, for example, loosening time limits where normally you don't. Pay attention to that. Normally you run a 50-minute session, you start more or less on time, let's say Jewish time, 5 minutes late, but at least somewhat, within reason. But then with this particular client, for whatever reason, you don't end on time, you go 20 minutes over. What's pulling you into that? You find yourself not charging this particular client for cancellations, when normally you charge people for cancellations. You find yourself, this particular client, you find yourself doing things like, they email you at 2 a.m, and let's say you're up because you had a late night or whatever it is, and you check your email, and you find yourself responding when normally you respond during business hours to emails. What's going on in you that's pulling you toward loosening these boundaries? The problem with loosening boundaries, now again, are you justifying it? Margaret really needs me. I need to respond to her. If you find yourself doing that in an excessive way, what's going on for you? The problem also, of course, with this is that weak limits don't feel safe for people. So when you begin to break those boundaries, what you're doing is you're weakening the therapeutic frame. And when you do that, what ends up happening, of course, is the client gets the impression that you're no longer as predictable, as safe, as reliable as they thought you were. So it actually comes at a cost. Boundaries get even looser, you become the client's friend. You engage in excessive amounts of self-disclosure. I sometimes supervise therapists, who engage in a lot of self-disclosure. I'm not against some self-disclosure. At the beginning of this talk, I self-disclosed a little bit about myself. In my book, In Trauma and the Struggle to Open Up, I talk in some detail about my family's history. So there are clients who've come to see me who've read my book, and they know a little bit about my background. I'm not against a certain limited amount of self-disclosure. Where self-disclosure gets you into trouble is when it's to such an extent that it's no longer oriented toward bringing safety back in the relationship. So in Judith Herman's Trauma and Recovery, her first goal of psychotherapy, before any kind of trauma processing can happen, before any EMDR can happen, before any parts work in internal family systems therapy, any kind of therapeutic intervention kind of work, before any of that can happen, first there has to be safety in the relationship. And so when a client asks you, and you, let's say, are young looking or whatnot, well, do you have kids? How can you possibly understand how hard it is for me to be raising my kids? I mean, you don't have any kids of your own, do you? You look so young. Let's just say that's a challenge that sometimes I used to get. I'm a little bit young looking. I'm 61. But anyway, when I was in my 30s, I looked like I was 18. So I sometimes would get that from clients. Do you have any kids of your own? Actually, I do. Anyway, sometimes I would get that. So that kind of challenge, how much self-disclosure should you engage in? The mark I use is as much self-disclosure as is necessary to bring safety back in the relationship. So a kind of typical example I might get from some of my clients, some of my trauma clients, something like a client saying to me, are you really, I feel like sometimes, I'm not sure, I don't want to be wasting your time, Dr. Muller. There must be so many other clients that you can see. And let's say this is a person who really needs help, let's say, and I've been working with them for a couple. And I might say to them, Kelly, I'm curious, what's coming up that you're wondering about wasting my time this week? Like, what's going on for you? So that's a mentalizing question. What's, asking her to look internally, to self-reflect. What's going on for you that you are wondering about that now? Well, I didn't really want to tell you, but I don't know, like last week you seemed, I don't know, the best word I can put it is bored by me. I don't know, I feel like I'm boring you, all right? That's an interesting moment there. You have a client who's presenting something to me, and where do I go with that? And she's presenting something to me about me and about our relationship. Is this a relationship where I find her boring and I'm just putting up with her and all of that? What's really going on? And her, of course, being a trauma survivor and feeling like she never really, she was in the way all the time as a kid, to her, the first thing she goes to. And so where do I go with that? And so what I often do is I use the thought bubble technique, which is to sort of stop and read my thought bubble out loud. And so I might say to her, and this is a very typical thing that I might say, give me a second, Kelly. I want to have a second to think about this. And partly what I'm doing is modeling the idea of mentalizing, but partly what I'm doing is actually literally trying to work with my countertransference in vivo. And so I might say that. And so I would say something like, give me a second, Kelly. I just want to think about that for a second. Okay. Okay. I'm just kind of thinking back to last week, and that was right. That was that session where you were talking about XYZ, and she's like, yeah. I think you're right. I think you're picking up on something. I was actually feeling something. Now, it wasn't that I was bored. I was actually preoccupied by something happening. I was going to go to somewhere after, at the end of the day, and I wasn't sure I'd have enough time. Like, if that's true, I would only say that if that's true. But this is often something for me, is that I get distracted or something like that. Sometimes I say to clients, if it's true, yeah, you were picking up on something. Actually, when you mentioned that thing about your boyfriend, I wasn't thinking that you're stupid. I mean, I know you're worried that I was actually feeling anxious. I was finding myself feeling a little bit worried about you. So that might be something I might say. So in other words, I'm engaging in a certain amount of self-disclosure. I am. But that's where I would stop, and I would say to Kelly, what's that like for you, hearing me say that I was worried about you? So I would just stop there and then work with her at that moment. Why? Because this is enough self-disclosure to bring safety back in the relationship. She's worried, she's projecting, and very often trauma projections are things like, I'm wasting your time, I'm worth abandoning, I'm not really a legitimate person to have therapy, I'm etc. There's so many things. I'm worried that sometimes clients are worried that you're going to betray them or that you're going to, etc. There are many projections often around rejection, around loss, around abandonment. Those are often the themes that come up in trauma. And so I'll engage in a certain limited self-disclosure that's enough to bring safety back in the relationship. Again, why is that necessary? To limit the self-disclosure? Because lax boundaries feel unsafe. Why engage in any self-disclosure at all? Some might say. Why not engage in that traditional psychoanalytic, when you're worried that let's say something like this. Okay, let's rewind. Kelly says to me, I'm worried that you were kind of bored last week. Why wouldn't I just say to her, well, what would that mean to you if I was bored, right? That's a much more traditional kind of very holding the frame. And you can do that with many clients. You really can. The thing is that it requires a certain amount of ego strength for a client to be able to handle that kind of question. And with trauma clients, they very often lack that ego strength. There's so much projection. Remember, clients with trauma histories come into situations very often with the assumption that you're gonna betray them, you're gonna abandon them, you're gonna think they're stupid, you're gonna yell at them, you're gonna abuse them. These are all things that they're coming into the situation with. And so there's a sense of lack of felt safety that comes up very quickly. A certain amount of self-disclosure is necessary to bring safety back in the relationship. How do you know how much? I can't tell you. What I'll tell you is that it's a bit of a craft. And I would just say, if you use that idea of limiting the self-disclosure so that it's just enough to bring safety back, then that's something that you can really work with. That's a principle you can work with. It's consistent with trauma theory because we always have to have safety before we can do trauma processing. And safety is a process. Even if you do a lot of work around safety and you've been working with the person for 2 years, they may then project something else onto you because of something else happening in their life, and all of a sudden they feel unsafe.
Elaborate for a moment why telling them how does that feel for you that I was bored or whatever, why that makes them stay unsafe?
Because you're entertaining something that you know is not true, unless it was true. Now, sometimes I've had clients call me out on stuff that is actually a little embarrassing. Maybe I actually was distracted. Maybe I was. And then that might mean some work.
Dishonest, essentially, which is a lot of the ruptures that they already experienced.
Exactly.
So just adding to the...
Adding to it. So some of it, again, I mean, it's tricky because there are a lot of principles in trauma work that Judith Herman talked about, that I talk about in Trauma and the Struggle to Open Up. One is honesty in the relationship. And if you don't disabuse the person of something that really is not honest, then that's going to be problematic in the long run. Yeah. But it's a delicate balance, and I know that people probably are feeling uncomfortable, which is kind of my hope. Is that I'm hoping to make you feel a little uncomfortable. It should feel that way. Yeah.
I guess my question is, like, on the other side of it is that the indulgence to disclose
Right.
Is also part of the rescue fantasy.
Exactly. And so this is where we get into that classic argument between Sándor Ferenczi and Sigmund Freud that lasted for a few decades, and in the early 20th century, where Freud was of the mind that it's better to frustrate a client than to indulge them, and Sándor Ferenczi said it's better to indulge them than to frustrate them. And self-disclosure hits right in that issue. Like, how much do you share? How much do you, how important with Sigmund Freud, boundaries, the therapeutic frame was all important. With Ferenczi, closeness in the relationship and the corrective emotional experience, as it came to be called. He didn't coin that term, but one of his disciples, Franz Alexander, coined the term the corrective emotional experience, where being in a relationship with someone who helps you come to a place where you can feel cared for, loved, like you matter, like you're to be validated, all of that's all comes from Sándor Ferenczi's work. And so finding that balance is really tough with trauma clients. So thank you. Exactly. If you go too far, the client will feel indulged. That's exactly what Freud would say. But yeah, I mean, and it's a tough balance. I mean, yeah.
I'm just curious.
Yeah.
It's really similar vein. You share, actually, I was really tired, meaning like a somatic kind of like, or I was getting sick, because otherwise that will make the patient nervous about you. And I'm saying, like, is that too much of a disclosure?
And so he...
Meaning, like, just because of that.
I mean, I would err on the side of limited honesty. Like, I mean, what is too, like, I mean, I supervise therapists who sometimes they're not, some of them are not that well trained, unfortunately, and they've learned that, for ideological reasons, you really need to reduce the power balance between therapist and client, and so be really honest. And I find that clients really react badly to a high level of honesty. They say things like exactly what my previous therapist was, she told me about her substance abuse history and about her, how, all that stuff. My therapist was more messed up than me. I didn't feel safe in that relationship. And so it's a tough balance. So do you disclose, I would say limited disclosure, but the most important piece is then exploring the meaning to the client. So if you are sick, if you were coming down with something and now you're not sick anymore or whatever, I was coming down with a cold, like the client, a month ago there was this time you seemed distracted. And like, actually I was actually thinking that I have a cough and I was worried that I was going to cough during session and I felt worried that you were going to get upset. So actually I was coming down with something. Let's say you said that. I'm not sure you need to say all of that, but let's just say you did. Let's just say that's what happened. What does that mean to you? Like, what does that mean to you? What fears does that bring up for you? What worries does that bring up for you? How do you feel? I would just really explore the meaning of it with the client. And if there's, I have a client who, it's funny because I'm 61. I don't feel like I'm really old, but she's 32 or so, and she sees me as really old, and she says to me, well, we're starting this trauma work, but you could die very soon. Like by the time you're in your 70s, I don't know that you'll be able to be here for more than 10 years. Like, I'm not planning to die. Anyway, but that's her fantasy, that's her fear. If I had a culture, if the situation you're bringing up in that context, that might be, but then the meaning of it, really exploring the meaning of it afterwards, it would be. Yes?
I wonder if building on this point that you're making about exploring the meaning, I wonder if really this is about being able to honestly check in with ourselves and ask ourselves the question of, is this self-disclosure right now relevant to the client, to the treatment? Where is this coming from within me?
Exactly.
Because I also feel like those two questions, is my therapist clinical or is my therapist more messed up than me? To a certain extent, those might be inevitable, right? And to what extent do we have to make sure to avoid the client possibly thinking those versus, I guess, taking for granted that those questions might come up, and rightfully so. Mm-hmm. And I guess in the context of exploring it, maybe keep those in mind.
100%. No, I totally agree. Enactments are inevitable, and that's why after the break we're going to look at an enactment that went really south and how to get the relationship back on track when an enactment really goes south. So I agree with you. They are inevitable. And questions around the therapist being capable, questions around, is my trauma bigger than the both of us? Questions around, do I feel held in this relationship? These are all questions different clients, and especially with clients who have trauma histories, but also have personality disorders, especially in that case, it's full-on inevitable. It will happen, and you will absolutely need to work. Enactments will happen. The smallest little thing could happen. With one client I worked with who was narcissistic, he saw my diploma from Michigan State University. My PhD was from Michigan State, and in my office, and he says to me, "Michigan State, that's not the good one, right? University of Michigan's the good one, right?" And there were, and it's a funny example, but then, the issue of, well, really, am I, and sort of him needing to feel above me and needing to, and then what did it mean when he, of course, was sharing something that was vulnerable, and then he felt below me, and then that was like, oh my God, this person's going to crush me, all these fantasies came up, not because of anything I did wrong, but just because it was inevitable because of the dynamics. And so I agree with you. Countertransference is about coming to, it's not about avoiding that any of this is going to happen. It's about taking a moment to think about your feelings so that you don't act on your feelings and unnecessarily trigger something in a client that didn't have to be triggered. Having said that, even if you do everything right, your clients will get triggered. So, yeah. And also, working with your countertransference is about asking yourself, what's going on for me? Exactly as you pointed out. Yeah.
I'm appreciating everything you're saying.
Sure.
Thank you very much.
For sure.
We're talking about self-revelation of, okay, I was tired, I was anxious, or I was... So if I can just push back all the way, the other way, just to
Yeah.
hear more this way.
Yeah.
Talking about indulging the client, what would be wrong, or not wrong, but just moving to 100% reassuring the client, but not bringing up, oh, I was tired, I was anxious, which also could be like, is he capable? Is he always tired? Am I in the wrong hands?
Right.
Wouldn't it create more safety in a certain sense, just reassuring them, being like, oh, like, of course I want to see you, and I look forward to our meetings together, and just sort of shining the flashlight in the other direction.
This is where, no, this is exactly where it's so hard with trauma work, because you're hitting on another principle, of a really important principle of trauma work, which is the real relationship. Ralph Greenson, a psychoanalyst in the 1950s, coined the term the real relationship. And why did that have to be coined? Because psychoanalysts were getting a little too caught up in the fantasies that clients have. Now, those fantasies are really important because clients who have personality disorders project, and many clients with trauma histories, there's a correlation there, project like crazy onto the therapist, project onto the relationship. So why is the real relationship important? Because there are times when you just need to say to your client, do you need a glass of water? Hang on a sec, I'm going to go get you a glass of water. You need to be a mensch sometimes. You just sometimes need to just say, no, of course I want to see you, Kelly. Of course I do, but let me think about your question, because it's a good question. What was going on for me? And so I might differentiate in that way. I might do something that's, I think reassurance is helpful, where reassurance, like when things have been written a little bit about the real relationship and about reassuring clients in the real relationship, some of the criticisms have been that you might lose an opportunity for exploration. And so, but you can...
In terms of the meaning.
Yeah, but you can do both. You can say, of course, blah, 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 or let me reassure you that such and such. It's really important that you understand that I really feel X, Y, Z. At the same time, let's explore your question, because it's a good one. I was a little distracted last week. What was that like for us? What was that like for me? What was that like for you? So you can sort of bring it in. I strongly encourage opportunities to bring the relationship into the room and to seek opportunities for exploration. And you can do both. So, yeah.
So it's a real relationship in terms of the way
Yeah, I think if it's, again, some of it depends on the client's ego strength. So with those clients who've got really good ego strength, they may not need the reassurance. They may be like, oh yeah, no, I know you like me, Dr. Muller. I'm not worried about that. I really want to understand. And they're really there isn't a need for that. And with some trauma clients, absolutely, that would be necessary because there's so much projection and fear. They still may not believe you, and you still might wonder with them. As I say that to you, as I say to you, I'm just thinking about, a moment ago I said to you such and such, which was me trying to reassure you. What was that like for you? Oh, I'm just assuming you're lying to me. You're probably just being nice.
It's like you want to dive into
Yeah. Yeah. And so even if you reassure, there might be this anxiety that you're just doing it because it's your job, because they pay you, because, and that's something that you can, and I would, yeah, that's right. There's no way, and that's really tough. I might say it's really tough for you to know, am I reassuring you now because I feel it? Or I can say to you that I feel it, and I do, but as I do that, am I manipulating you? Am I being dishonest with you? If I'm hearing you, is that what you're saying, Kelly? Yeah, I don't know if you're really being honest with me. And then that's really hard to not really know what's in the mind of somebody else who you really care about. That's so hard. So here you are, and we can't really fully know what's on each other's minds. We can only, we only have our words. That's tough. So there, I'm getting into a little bit of maybe a Yalom style existential, that we're all ultimately alone kind of comment. But anyway, but I try to use the relationship where possible, and yes, I would use reassurance, but not only that. I would use it with exploration. Well, we have no, we don't actually. We need to stop in the next minute or two for your break, because for those of you who need to check out, please check out. Come back here by 11:05. Before you go, let me just say to you that so after the break, we will be talking about a few examples of the relationship actually going off the rails. And I like to call this section, how to get the therapeutic relationship back on track in 4 easy steps. So we'll see that after the break.
The exercise helped the in.
Okay, good. Yeah, for sure. Yeah, take care. Okay, for sure. Yeah, no problem.
You totally commitment. I'm doing it.
All right. Yes.
I don't know if I'm right or not.
So I'm not a psychoanalyst. I'm not a psychoanalyst, no. I'm psychodynamic in my approach for sure, but I do face-to-face. I mean, I have a couch, but but we're sitting. Yeah, I'm sitting in a chair, and clients are sitting on the couch typically. Yeah. Yeah, you had a question.
You talk about self-disclosure more as like bringing safety in the room. I'm wondering, what about if whatever you're going to share will help the client as far as like it would be relevant in helping them understanding the specific concept, and what you will share will be something about your life or your history.
I mean, I think it's a delicate balancing act. I mean, if it's a self-disclosure, I think the question to ask, who is this for? Who is this self-disclosure for? Is this because of me, or is this because of the client? What is the purpose of it? Am I bringing safety back into the relationship? Does the client need to know this about me, or can... the example you gave was a really good one just a moment ago about... will you share your example with the class? Is it a group? Not class, sorry. I teach in a university, so there are always classes. Yeah, go ahead.
No, so like a client was talking about the challenge being in the frum community and not being married yet, and she's 30 now, and I'm like empathizing and validating, but she's like, but do you really get it? As much as you could say. And so it was like, do I share? I also got married at 30, like later on, or what? And like just saying like just a little bit of just that disclosure of like, yeah, I've been there, like I get it, and like no, it's coming from a real place. I know I can understand the emotions behind that situation without being like, oh, it was so hard, and going into all my like personal stuff.
Right. And what I mentioned was that of course you could, I mean, like there are going to be times where you're going to, clients going to say, well, do you get that? I mean, like and you might say, oh, yeah, I mean, I get it, such and such. But the thing is that no matter what, there's always going to be something that the client, a way in which the client's life is not like your life. And so that question of being alone in your suffering is going to be something that's going to come up regardless. And that's kind of, again, part of that existential issue that clients grapple with. Let me move on, because we really won't have time if I don't. So we're going to blow past all these slides on countertransference. They're in your slide deck, which you all got copies of. If you didn't get a copy of the handouts, they're right up here in the front. So please, if you came in a little bit later and you didn't get a copy of the handouts, please take a copy. And we will now move from and countertransference. I only touched a little bit of some of the different countertransference patterns. You can find much of this material in Trauma and the Struggle to Open Up. Also, in my first book, Trauma and the Avoidant Client, I have a chapter on countertransference with clients who are treatment resistant. So let's talk now about what to think about around this issue of the relationship going off the rails. And here I talk about enactment, rupture, and repair. Let me say that traumatic reenactments are very common in trauma work. So even if you're doing all that work of examining your countertransference, even if you're in the habit of thinking about the dynamics that happen between therapist and patient, even if you've been through therapy, even if you've supervised people and you have an approach that values thinking about the therapeutic relationship and thinking about your role in it, even then, things happen sometimes where we step into or stumble into some kind of enactment. And rescue fantasy is the only one we talked about of previous examples, but anyway, rescue fantasy is a nice example of that. The guru enactment that I talked about is a nice example of that. And what we are seeing, as David Wallen talked about, as I mentioned in the first half of our talk today, is the interlocking of client and therapist attachment patterns, or client and therapist attachment history. So this is inevitable. It will happen, as the gentleman in the back pointed out. It's kind of inevitable. And it's not really about necessarily, quote, avoiding always, so much as becoming aware of what's going on between two people, one of whom is really suffering because of their history. Navigating it is key, and that's really what we're going to look at today, is navigating enactments, ruptures, and repair. So let me give you an example here. This is the case of Nigel. And what we are going to do is we are going to start with a brief 5-minute clip from the adult attachment interview that I did with Nigel. Yeah. And how many folks here have been trained in, it's okay if you haven't been, I just want to know what audience I'm talking to. How many people have been trained in the adult attachment interview? Okay, only a couple. So let me just share a little bit about the adult attachment interview. It's essentially just a few sentences. It's essentially a developmental interview, but what it does is, the beauty of the adult attachment interview, if you will, is that it activates the attachment system of the client by asking some really tough questions. So you don't typically give an adult attachment interview in the first session. It might be a few sessions in. So in this case, because I felt in that first session that I saw Nigel, I thought things were going quite well between us. I felt that he could, in our second session, deal with an adult attachment interview, and so I did. And the adult attachment interview has a technique where it asks you to give 5 adjectives to describe your childhood relationship with each of your parents. So you might say, Nigel, give me 5 adjectives. At this point, I'm going to ask you, give me 5 adjectives to describe your childhood relationship with, first, your mother, going back as far as you can remember, but under age 12 is fine. And they give you the 5 adjectives. And then you ask them, and then after they give you the 5 adjectives, then now, Nigel, I'd like you to go back through the adjectives one at a time and tell me any examples, any memories, any anecdotes that illustrate the adjective. Why is this interview helpful? Why is this interview so powerful? Because what it gets at is autobiographical memory. Remember at the beginning, the first half, for those of you who weren't here, we did a little exercise where I asked folks to think about a specific autobiographical memory and to think about the emotions that it raised for them. Especially an autobiographical memory where they felt vulnerable or where they felt overwhelmed emotionally. And yes, this in the handouts. Yes, we're about halfway through the handouts here. No. The adult attachment interview. So, if you're interested in learning the adult attachment interview, it's quite involved, but it's very doable. There's a book by Steele and Steele called Clinical Applications of the Adult Attachment Interview. I think they published it in 2006. Howard and Marion Steele, Steele, Clinical Applications of the Adult Attachment Interview. In my book, Trauma and the Struggle to Open Up, I talk a lot about the adult attachment interview, so you can get a lot of the clinical applications there as well. So it activates the attachment system of the client. So it's very, very helpful as an interview to start right very early on in the process, getting at some very clinically relevant material. And you see how people deal with their own stories, how they might struggle with their own stories. Okay, that's enough about the adult attachment interview. Let me tell you now that Nigel, so you're going to watch a little 5-minute clip. This clip is actual clinical material. It's an actual patient and actually me. However, it's being reenacted by an actor. So the actual person you see, in order to protect confidentiality. So it's actual clinical material, but protect the confidentiality of the actual client through using an actor. So I asked Nigel to give me 5 adjectives to describe his childhood relationship with each of his parents, mother or father. I asked him about his. Then we went through father, and I said to him. And one of the adjectives he gave regarding his childhood relationship with his father, going back as far as he could remember, was volatile. It was a volatile relationship. And so then we went through the adjectives, and I said, "Okay, Nigel. So now you mentioned volatile. Any memories, any examples, any incidents that illustrate the relationship as volatile?" And this is what Nigel said. Now. When we watch this, what I'm going to ask you to do, because the purpose of this talk is to really look at the therapy relationship. And as obviously the example is one where there is you know that there's going to be an enactment and a rupture. That's what the whole talk is titled. So think about what you see already in the nonverbal behavior, in anything that illustrates anything to you about the therapeutic relationship. Think also about, if you were the therapist, what emotions would come up for you? What would be hard for you? What would you be grappling with as you hear this young man's story?
Should I get the light?
No, it's okay.
Yeah, right. So, volatile. He had a short fuse. Explosive. I recall getting spanked to the extreme a lot. Sometimes for being cheeky, but sometimes just for getting excited about something. There was so much violence. I get screamed at and punished for bringing friends home when I wasn't supposed to, for breaking the rules. For Star Trek, he hated my collection. I had an odd fascination with Star Trek. He called it rubbish, bloody stupid, American. I had everything. Collectibles, action figures, models, books, biographical sketches of the actors and the characters they played. And that all set Dad off. It drove him mad, really. He hated it all. Sometimes he'd confiscate parts of my collection until I'd do my homework. Maths especially. I was abysmal at that. And once a teacher, who was a miserable wretch, oh, she was just horrid, phoned home to complain about me. And Dad smashed my Star Trek collection. Broke everything. Threw it in the trash. And burned the books and everything else in the fireplace. I was screaming. I tried to stop him, but he wouldn't listen. I was screaming and pleading and crying. I wanted to die. And that was the end of it. I lost everything. Yeah. Everything up in flames. I sure didn't get any sympathy for that.
Okay, so I'm going to ask you to think a little bit about what emotions come up for you as you think about yourself in the role of therapist there. Remember, this is just the second session, talking about his childhood. What kind of emotional reactions might you experience? What do you imagine the therapist might experience? How might the therapist get drawn in? Yeah, yes. Sadness. Therapist might feel an overwhelming sense of sadness, even going as far as to experience perhaps despair. Yes? Empathy for the client, sympathy for the client, poor you, feeling, yeah, perhaps that would be a sympathetic kind of response. Yeah?
I'm feeling embarrassed and I feel like I'm on the verge of tears.
Okay. So you're really feeling it. Okay, good. To be aware of that. Broken-hearted, yeah. You imagine himself as a child, you feel broken-hearted on his behalf. Yeah. Yes?
Feeling the total helplessness.
Helplessness, yes. This little kid not being able to change the course of what's going to happen there. Yeah. Is that right? Is that kind of, yeah, okay. Yeah?
I notice myself getting angry at the mother. Like, wondering, where's the mother?
Good, okay. Right. So isn't that interesting? So your projection is related to kind of this character who's not even stated in his story, but right. So that's really a nice example of you noticing something that's going on for you, and what would that mean if you were working with this client? I mean, I don't know, but it would be really important to be aware of that, right? I mean, yeah.
I also wonder that if this is just the second session and he's sharing something like this, what else is coming up?
Okay. Yeah, right. Is this the tip of the iceberg, and there's going to be a whole deluge of stuff, right? Yeah. Yes.
So anger towards the father,
Anger.
and also like a part of me that's
Yeah.
like, okay, wanting to rescue
Right.
the client.
Right. Okay. Yeah. Absolutely. Okay. And yes.
I was thinking, like, what was the father's situation growing up and what he thought was reality?
Okay.
He seems to be a different country and he's doing American. Like, it sounded like the daughter had the good intentions, just they weren't executed. So that could be something.
Right. So and so there perhaps a curiosity about the father's situation, where what prompted this kind of reaction might be. Okay. Good. So those are some nice examples. Let's think now about, okay, so that's just sort of an introduction to Nigel, kind of opening the door to us thinking about him. And now I'm going to tell you some things that, I don't know what it'll do to how you feel, but it'll be interesting to see. So Let me tell you a little bit about the early context in which I came to meet Nigel. The original call for therapy was from his partner, his wife, who told me that that Nigel had been in a really bad car accident, and I said to her, "Well, okay, no problem. I mean, he had a trauma because of it." And I said, "Okay, no problem. I'll need to hear from your husband if I'm going to work with him." And she said, "Okay, I'll tell him to call you." So he did. And so I set up an initial meeting with him. What I knew in that initial telephone call, I mean, not much, just that he'd had a really bad car accident. And so there was trauma and that he needed some help. And early on, some of the things that I find out about Nigel are that, yes, he had a car accident, but that original call was him calling me from the hospital because the car accident was really, really very bad. We set up an appointment for a few weeks from then. And what are some of the things that I find out early on? So we start working together over the course of, let's say, first couple sessions. Let me just share with you what I find out over the first 2 or 3 sessions. So Nigel shares with me that he, as a young man, had a really bad drinking problem in his 20s. So he grew up in England. He went to law school there. Early on in law school, or even before that, even when he was just doing a couple of years of study prior to that, his drinking started to get really bad. By the time he was in law school, he was, how he described it, a full-blown alcoholic. Drinking was so bad that he actually had to take a break from his one of the years of law school. Luckily, the school allowed him to do that and let him continue afterwards. Joined Alcoholics Anonymous. Not all my clients find Alcoholics Anonymous helpful, but Nigel did. He found it extremely helpful. He said that it saved his life. He had a sponsor, etc. And he was on the wagon and able to manage his drinking. Finished law school, moved to Canada. So this is a case who I saw in Toronto. Moved to Canada and was fine in terms of drinking. Got married, had a couple kids, had a couple little kids. By the time I saw him, they were teenagers. By the time I saw Nigel, his kids were young teens. And what else do you need to know? Something happens at work. Something triggers him, and it's not that important right now to talk too much about that, just to say something throws him off track. He went to a bar, had a drink, and boom, he was off the wagon. Went into a 3-week bender, which ended with him hiring a sex trade worker, driving somewhere drunk, and they were luckily both wearing seatbelts, getting into a terrible car accident where the car flipped off the road, and luckily nobody died. Neither him nor the woman he was with died. Just some scratches. It was quite remarkable that happened, but bruises and that sort of thing. Okay. He has to tell his wife, right, about all this. So he does. What does his wife do? She springs into action. She takes care of everything for him, calling to see if he can see a therapist. That was the call that I got. Calling to make sure that he wouldn't lose his license as a lawyer, making sure that, taking care of everything, calling his partners at the law firm to make sure that he could have a few months off. And so this is the context in which I meet him. So it's interesting because in initially meeting him, I had a whole bunch of different feelings toward him. As you can imagine, a variety of different feelings. In part, all what you described, around his history, and in part, lots of other things as well. So we start working together, and Nigel quickly engages in therapy. We have a good therapeutic alliance. He's active in the work, and he is interested in understanding he was open to the idea that he had a trauma history and interested in working with me. All right, so that's the background. So let's talk now a little bit about, so there's a good connection that formed over the course of a few months. This is a section on enactments, ruptures, and repairs. So let's get to the enactment, rupture, and repair, shall we? At some point, the therapeutic relationship starts to shift. So let me read you a little bit about this. And this is from Trauma and the Struggle to Open Up, page 148. Nigel would write in his journal. He would mourn losses. He would connect to feelings. So this was over the course of the first 6 months of therapy. So he made good progress right away. In short, Nigel would do it all. He would engage. He would self-reflect. He would cry on cue. But with all this engaging and self-reflecting and crying on cue going on, it made it easy to miss the coffee deliveries. There weren't many of them, just a few, before the cancellations started happening. Nigel would show up to sessions with a coffee for himself and one for me, right? Normally, this would be something I would just ask about. That's certainly easy enough to do. A gift of sorts, right? Client gives you a gift, you ask about it. You might accept it, you might not accept it. What does this mean? What does this mean between the two of us, right? All of that stuff. What does it mean? What motivated it? What does it mean if I accept this gift or if I don't? More important, what does it mean to him? These are all useful questions, and they relate to issues of feelings of rejection from the past, right? Feelings of connection, reciprocity, the feeling that we matter to someone important to us, all important themes in trauma recovery. Soon, coffees became scones. He would show up with 2 or 3, the good kind. And I love scones. Same issue, a gift, easy enough to inquire about, right? But I didn't. And again, it's only on reflection that I realized all this coffee scone gift-giving drama was going on at all. At the time, his simple, "Want a scone?" was only a quick exchange, after which he would launch into something else, typically something relevant or important about his family or his past, and coffees and scones would fall off the radar. All right, here's my question to you. What was going on? What were we enacting? Something was pulling me away from awareness of the relationship, from noticing it. Remember I said about countertransference, your strongest tool is to notice it. That's the tool, is noticing your countertransference, paying attention. But when an enactment happens, something has gone off, something has gone awry. So what was going on? Something was pulling me away from awareness of the relationship, from noticing it, from being mindful of the interactions between the two of us, the space between us. All right? What's going on here? My question to you here is, how was I getting drawn in? And what unmet needs were we gratifying in him? And what unmet needs were we gratifying in me? So imagine yourself, and don't worry about, I'm not gonna be upset if you're, like, this is an example of the relationship going off the rails, right? So let's really be playful here. What unmet needs do you imagine? So if you mentalize, if you were, first of all, the therapist, what would you mentalize about your experience here if this sort of thing happened to you? How would you, let's think about that. What unmet needs? So the question I have for you is, how was I getting drawn in? And what unmet needs were being gratified in him and in me? Yeah.
So this is related to something that I was feeling before, but I was afraid of everybody's judgments. I didn't say anything.
Oh.
I was feeling kind of annoyed actually by him, and the reason, and I wasn't sure if what I was, if tell you why I was really annoyed. It seemed very dramatic and contrived, and the emphasis and the wording. I wasn't sure whether that was like because this is an actor, kind of like saying over Nigel, or if this was actually him. But I was imagining myself being with somebody who's actually talking like this and feeling annoyed because he's putting on a show. The story may be a true story, but he's putting on a show for me.
Okay.
And now that you're telling the story of the coffee, this sounds like somebody who feels like they need to buy my love and attention.
Nice.
And I imagine maybe that's where the coffee and the scones will come in.
Okay, good. I'm going to stop you there, just so other folks have, but that's fantastic. Fantastic. Great. So you're mentalizing what might have been going on? I'm not judging you, I promise. I never judge anybody. Yeah, as if. Yes.
It feels a bit intoxicating. You're doing transformative work, so you really bought into the fact that this therapy is moving and it's going and we like it.
Good.
So it was a little bit of a bribe in that way.
Okay, good. So you're talking about what unmet needs were being gratified in him. You're talking about what unmet needs might have been gratified in me. Can you just be more specific? That's really great, intoxicating. What do you imagine unmet need could be gratified in a therapist who feels intoxicated, the way you put it, by how good the therapy was going?
That you are good.
I'm good. I'm a really good therapist. I'm appreciated by him. This is fantastic. I'm just exaggerating a little bit just for the sake of, yeah, right, good, excellent, yes.
So you're acting like a surrogate father to him?
Maybe I'm getting pulled into kind of a father figure space for him. And again, the question of what might that meet in him, there might be something there, and what might that meet in me? Why might a therapist want to be pulled into being a surrogate father? Is it rescue? Is it something else? But exactly. Nice.
From a relational standpoint, by the way, everyone, I'm judging you, but I'm judging favorably.
What a liar.
From a relational standpoint, I'm wondering, it could be what he's doing is, in his relationship, what you're describing, the wife's a caretaker, potentially, and he's the one that's with all the problems.
Yeah.
She's just fixing it, taking care of him. So now he's with you again. You're the caregiver. You're the caretaker.
Yeah.
What he's trying to express to you is how he wants to provide as well, but he can't. So he's doing that, maybe slipping in the different care for you because he's trying to shift the dynamic that it balance it out more.
Nice. Okay. It could absolutely. Yeah.
I just see a picture in my mind of his little boy heart, Daddy, look what I got for you. Do you love me now? Do you accept me now? Am I good enough? That's what I see with all the coffee and the baked goods.
Right. That's good. Very, very nice. Yeah.
I'm just curious, how did he know you like scones?
So maybe or
There's a whole selection at the bakery.
exactly like that's a great. So I don't have an.
You know what I mean?
Right. Exactly. I don't have an answer for you, but that's an exact.
Scones are more fun. Maybe like he wanted you to like his scone collection.
Yeah. Maybe. Yeah. Right. And yeah. Sure. Yeah. Could be. Yeah.
First, I very much felt the way he felt. I felt like, oh, I'm in therapy. I'm not feeling him, right? That was my reaction to the thing.
Okay.
I think, is it possible that you were thinking like that you are repairing the relationship with his father by that you so quickly formed a relationship where he feels close to you and comfortable enough to give you,
Right.
and that felt like, oh, it's part of the therapy.
Yeah, and it could easily be, and that's not necessarily untrue. I mean, it may have been part of the therapy in the sense of him feeling that connection, but there is a question around what was motivating me to want to have him feel that way so much. And is there something being met, some unmet need being gratified in me that I would be motivated to engage in that kind of enactment? So, good. Like I'm a good therapist, that I'm a good father figure, all that could go with that. Yeah.
I think he's also, whenever somebody gives a gift, I wonder what they want back. Especially,
Yes.
Kids, especially when kids do that, I wonder what they want. But But also it's a question of, am I lovable?
Uh-huh.
Wait,
Mm-hmm.
for the therapist
Mm-hmm.
and for the
Yeah.
patient.
Yeah. Right. Nice. Nice. Okay. Okay. Good. A couple more hands are up. Or yeah. Go
I
ahead.
was just saying, like, to be piggybacking, but if someone is just like in this dynamic, like, oh, I'm the one with the problems, I'm ever look now, I'm in this place of like, oh, I'm a problem person, oh, I'm a caring person, I could be seen in like a normal way that doesn't have problems, but I'm just like good, caring guy, and maybe like getting stuck in like, okay, I'm giving it that to that person to like feel good about themselves in a way of like having other parts of them that are
Yeah.
good.
Yeah. Good. Okay. And yeah, last
Feels
comment.
like the stones were a distraction from the real gift, which was the tears. If
Mm.
you saw it as a gift, you maybe think differently about the therapy. Tears are probably the best gift the therapist could get you.
Right? Isn't that? Yeah.
When they cry, it feels great.
Yeah.
I came for it.
That's great. And you're gonna say something? Oh no.
I'm sorry. I was wondering if he was like overcompensating for feeling some negative feelings towards you, and that's kind of his way of hiding them. Like especially because you mentioned you mentioned the end of therapy a little bit later.
That what?
Did he end therapy a little bit later? He stopped showing up for sessions a little after that. Like,
You'll see. Okay. So all right. Good. So these are. So I mean, I really just wanted to engage in a kind of a mentalizing exercise. How reflecting on what might have been going on for each of us. If you were the therapist, I really appreciate how you were very willing in these comments to be vulnerable enough to explore what you might feel in this kind of situation, even if it isn't whatever, how you might think one should respond or what that sort of thing. So thank you. So that's great. So all right. So let's look at an act. We will come back to Nigel in a moment. Let me just do a bit of theory here for a moment. What is the problem with enactments? So there's some sort of enactment going on. Like we don't exactly know. We have some hypotheses. We've been playing with underlying motivations for the client and for the therapist. Great. We're not sure exactly. But what we can see is that something is being acted out. How do we know that this is an enactment? Because it's atypical. It's not the kind of thing, I mean, if you're a therapist, this is not, like I asked you, what's getting triggered, like in the first part of this, before the break, what's going on for me that I'm saying and doing things that I don't normally say and do? Now, of course, that requires you noticing that, but typically when we stumble into an enactment, we're not actually even noticing it. It's just happening. And we may justify it. Oh, well, it's okay because of X, Y, Z, or we don't even think of justifying it. We're doing it unwittingly. Enactments are a problem. Why? Because they feel unsafe to the client. At the end of the day, boundary violations, even small ones, feel dangerous to trauma clients. That's one of the really important things. As I mentioned, Judith Herman's Trauma and Recovery, the first step in trauma work is safety. And it's a step that continues throughout the work. Even as clients are doing trauma processing, things will come up that will lead them to feel unsafe, and then noticing what's going on in the therapeutic relationship that might be leading them to feel unsafe, where some kind of transference reaction happens that throws the therapy off track. That's really, really critical in order to bring back safety ultimately. So boundary violations feel dangerous to clients. When that happens, containment is compromised. The client no longer is feeling that that the therapy is strong enough to hold them, that you are, they don't necessarily feel anymore that the trauma, the client needs to feel that this trauma isn't bigger than the both of us. If all of a sudden you're not feeling safe, then this trauma is bigger than the both of us. And how am I going to get through this if you're not strong enough, essentially, or the frame of the therapy isn't strong enough to be able to hold the trauma? Containment is now compromised. And the therapy has now crossed over into using each other for unmet needs. Remember before the break, I talked about the guru enactment. In the guru enactment, the therapist becomes kind of a quasi-guru for the client. Dr. Muller, should I do this? Should I break up with my boyfriend? Should I go back to community college? Do you think this? Well, Kelly, yeah, I think it's a good idea that I become her kind of person to go to tell her how to live her life or tell him how to live his life. We've crossed into unmet needs being enacted, and that's no longer therapy. You might be very nice about it, you might be very kind about it, but you're not doing therapy. You're doing something else. Therapeutic neutrality has been compromised, so that's the problem. All right, so let's return to the case of Nigel now. All right, last you heard, I asked what was going on. What were we enacting? Something was pulling me away from awareness of the relationship, from noticing it, from being mindful of the interactions in the space between the two of us. Well, out of coffee and scones came missed sessions. When at last he had his secretary email me to cancel, remember he was a lawyer, to cancel a session just before the appointment. His secretary! This undoubtedly affected me. How indignant I must have become. I sent back a very crisp, professional, clinical-sounding email, not mean-spirited, mind you, but one that had my most formal, not so warm, doctorally-sounding voice. My professional signature at the bottom, degrees listed. He'd clearly gotten the better of me. And again, I only recognize this in retrospect. And what was his email reply to me? Dear Dr. Muller, are you kidding me? Would you talk to your children that way? Nigel. And just like that, I faced the prospect of a therapeutic rupture. Okay, so went from bad to worse. Let's take a look at this. What happened? And my question to orient you is, how did I hurt Nigel? How did I feel hurt by Nigel? Something happened between two people who care about each other. Two human beings working together to figure out somebody's life, and something really hurtful happened there. What's going on? Thoughts? Yes, Rosie.
This is like the typical hurt people thing.
Okay.
And it really affected you, it jolted you
Yeah.
very much.
Yeah, right?
And you wanted to establish your professional boundaries.
Right.
All of a sudden.
Good,
Because
yeah.
you realized something went off.
Right.
And, but once the worm is out of the hole, it's very hard to put that worm back
in. Right, exactly.
And that's what you were trying to do, and he got you on that.
He did, for sure. Nice, yeah.
He went from idealizing you
Right.
and to devaluing you, and I was thinking that the reenactment was the shame and humiliation.
Nice.
Of his rage.
Right, exactly.
Just made you feel that.
Exactly, like, wait a minute, you're supposed to be idealizing me. What are you doing devaluing me like this? From my end, and from his end, any thoughts about what he might have been experiencing? Well, I guess just what you said, that he felt devalued initially. Yeah, and yeah.
I guess putting that into you.
Into me, yeah. Nice, yeah, that's what you were saying. So it's a projective identification. Okay. Yes? Sorry.
He also, when you're accepting of his scones and the coffee without it being an expiration, what it meant to him, it may have veered a little bit almost into like less therapist territory in his mind. And then when you send this email, like
Right.
this 30-foot wall boundary.
Yeah. Exactly. Like when you go from that kind of space where you've crossed into boundary violation, and then there's a crisp reestablishment of boundaries. Think about this: the client who engages in the kind of rescue fantasy stuff I was talking about, a little too much disclosure, a little too much chit-chatty, a little maybe even, we're sort of moving from therapist into friend zone, and then all of a sudden they get supervision, and the supervisor says, "Wait a minute, you really need to be," and then the therapist comes back in and establishes boundaries. The hurt the client feels, like, well, wait a minute. Exactly. It's crushing to the person. Okay, yes?
The question that I have is, did he feel a rupture beforehand, and that's why he felt to bring the scones and the coffee, and that one that wasn't acknowledged, and therefore there was another, meaning like there was a second rupture,
Yeah.
and therefore it wasn't, meaning like then he was already tackled or up, etc.
Right.
And then you sent the email, and then it was kind of like
Game over.
I'm done.
Yeah, I'm done. Okay. All right, good. A couple more, and then we're going to, keep.
So following along my train of thought is that it's a good thing, actually, because by you accepting the scones and coffee, you're making the relationship more balanced. The problem is that closeness is very difficult for him. So he's kind of hating himself or he's afraid, he's scared of the closeness. Because of that, he cancels through the secretary. And then you're coming ahead, and you got hurt by that, understand? I mean, you're coming ahead to put up the boundary, which in a way now he's upset again. What do you mean by I thought we have this relationship? So I see an anxious avoidant going on. On one hand, he wants the relationship. At the same time, he says, stay away. And then you're coming in and saying, okay, let's keep the distance. No, how come you don't let me in?
Nice. Nice, very good. And I think that connects to what you said earlier on around what's this performative stuff about? Is there something avoidant? Is there something dismissive or narcissistic about him? Where it's as if he's expressing feelings, but is it possible that some of those feelings are actually being masked by some kind of performative avoidance that's going on? Perhaps. I mean, like if we're playing with this, yeah. But that's nice. I think that those two comments very much relate to each other. Yeah.
That's what he's saying. Like he transferred, like you being the father, and I suppose he's not comfortable in that situation because he's not used to that. His whole life was the father reacted, so it was just a matter of time that it was going to elicit that from you to make him feel comfortable.
And here I go. I react, and it's as if I'm, reenacting all that father hurt that he had experienced as a kid, right? Okay, yeah, last comment.
I think you wanted your permission to grow up, and you felt upset by that, like a teenager that hurts his father by leaving him.
Wait, what? You're leaving? We're not done yet. Okay, good. All right, so all of these are I think, possible. I think this is really good. But here we are, in the middle of a rupture, and let's think about where do we go now? So first of all, let me just say what we have learned so far is that enactments are inevitable in trauma work, right? Enactments will sneak up on you. Even a therapist who is trained, and even a therapist who's in the habit of looking at their countertransference, enactments will sneak up on you. I specifically gave a very micro kind of enactment rupture as an example because I'm assuming that all the therapists here understand about obvious boundaries. And of course there are ruptures that happen when huge therapist mistakes occur. I gave this example because this is a kind of example that could be a small thing that turns into a big thing. And that's much more common, I find, with the therapists who I supervise, who have, the ones who have a lot of experience in trauma work, who nevertheless have countertransference things happen. It's very often these very small things that turn into a big thing. Sometimes it's not even necessarily even a mistake the therapist made. Sometimes it is. I do think there were mistakes that the therapist in this case made. But sometimes it's not, and you can be doing all the things right, and even then, like a client reacts, as I talk about in my first book, With clients who have an avoidant attachment, in trauma and the avoidant client, I talk about with clients who have an avoidant attachment, a therapist empathy, which is basic to trauma work, creates feelings of vulnerability and very often then lead to exactly what you said, what I call the distancing maneuver, pulling away. It's not that the therapist has done anything wrong. In fact, the therapist has done everything right, and yet it leads to problems in the relationship. So, and then you as a therapist are left to deal with that. So enactments sneak up on you. They can lead to therapeutic ruptures. The trick is using them in the therapy, navigating them. Okay, why do we repair? So let's look at repairing a ruptured alliance. Why do we repair a ruptured alliance? As I've mentioned now several times, if not, there's no safety in the relationship. But there's another reason why we repair a ruptured alliance, and that is because it's an enormous opportunity for growth. This is where there can be real change that happens right in that space. As I mentioned, Franz Alexander, his term, the corrective emotional experience. If you can repair a ruptured alliance, and if you can do it in a way where there is the opportunity for self-awareness, self-reflection, self-understanding, and it's connected to emotion, it can be an enormous opportunity for growth. It teaches the client, for example, that relationships can be repaired. With people who have severe trauma histories, that is not a given. Relationships have typically been unrepairable. Like if something happens and somebody's furious at you, it could be, for many people, game over. It could be abandonment. It could mean betrayal. It could mean rejection. It could mean a whole bunch of feelings that feel so vulnerable and overwhelming. So relationships can be repaired if you can repair a ruptured alliance. It also teaches that relationships are hard work. You know, a good relationship where there's intimacy, it's a process throughout the lifespan. And if you have a partner who you've worked on your relationship with, you know that you keep exploring and learning and realizing things about yourself that are not exactly things you're proud of, but here you are. They just are, you know, things about you that end up causing problems in your life, and your partner can realize the same. And if you can become empathic with one another in that process of realizing those things, that's the work of good relationship building. So you can do that in therapy. And when we repair a ruptured alliance, we are in doing so, in working with the client on this, we are teaching that relationships are hard work. And they're hard work that can pay off. In other words, relationships, and here's another one, they aren't doomed. That's something that so many clients experience. I mean, especially somebody asked last session before the break about reassuring a client. Like what happens if you reassure, so I think you asked about reassurance. You know, the idea that that relationships aren't doomed, that there's something actually that can be okay here. In working through, it's a real life example, like in the laboratory of the therapeutic relationship, the client can see that things can feel like they've gone off the rails, but they don't always have to. And so that's quite something. Okay, so that's the why. How do you repair a ruptured alliance, which is what I mentioned. Yes, before I get to the how, yes, questions?
The client feels that things get off the rail, or is it better to name it?
Well, I'll talk about what I'm suggesting the process of getting a relationship back on track when it has fallen off track to be, and then we can see if the question still stands. Is that okay? All right. So, how to repair a ruptured alliance. So what do you actually do here? The first piece, the intervention, is an internal intervention. It's a self-reflective intervention. It's nothing you do with the client. It's It's something you do with yourself. And that is adopt a self-reflective stance. Notice the enactment. Look inside. Look inside. So the first question is, as you notice that some sort of, so in this case with Nigel, he sent me this email, "Dear Dr. Muller, are you kidding me? Would you talk to your children that way?" So we can analyze that, and there's lots that we can come up with that would be very juicy and interesting and psychodynamic and really cool. So I'm sure we can do all of that. But we're not there yet. We're not there yet. And so I recommend not rushing to that spot, but stepping back and first noticing about yourself. What's going on for me? What went on for me? What got activated in me? Why then, of all the times that I've had ruptures happen with clients, or of all the times I've had challenges happen with clients, what happened here that a rupture took place? What happened in me? So what was going on then? Why then, of all times, did this happen? What's going on for me that I'm saying or doing or feeling things that I don't normally with clients? So with this client, after he sends me that email, let's imagine what might the therapist have felt? What might I have felt? Hurt or upset or angry or confused or all those things. Whatever the feelings are, asking yourself, what's going on for me that I'm feeling or I'm doing, acting on, saying things that I don't normally. Asking yourself, how did my needs activate this client? So what was going on in the history of my work with this client where some of my needs might have had some impact there? What this kind of exploration requires is a curious, non-judgmental stance. So in Richard Schwartz's work on internal family systems therapy, there's lots of things in there, but one of the things I love the most when he talks about, for therapists, he talks about the true self of the therapist. And I really like the way, what is a self? It's not a thing, it's an idea, it's a metaphor. There's no actual self, there's no actual parts, they're all just metaphors. But they're metaphors that are useful. That's why we have metaphors in therapy, because they're useful and they can actually be helpful in helping people's lives truly and get better. When the rubber hits the road, they actually help people get better. I really like the idea of the true self and some of the things Schwartz talks about. One of the fundamental aspects of being in your true self, in Schwartz's language, is adopting a curious stance. When we've lost our sense of curiosity, when we go to judgment, when we do that, that's when we are acting out in some way. We're not acting from a more authentic space. Of course, Carl Rogers also talks about this when he talks about genuineness. There's lots of therapists who have talked about this in various ways, humanistic therapists, existential therapists. So anyway, adopting a curious, non-judgmental stance is what's necessary when we look inside. What that means is you're first asking, okay, hang on a second, wait a minute, whoa, stop, what's going on for me? And so, you talk to your colleagues, you talk to your friends, you talk to, friends who are in therapy, or therapists. You talk to your peer supervision group and get supervision. If you're in supervision, you talk to your supervisor and get input. And the first question is really about yourself. The second step, okay, after the looking inside piece, and I'll come back to that in a moment. The second part second step is validation. Fonagy talks about validation as the first step. I disagree. I think it's the second step. Just a slight little disagreement. I mostly agree with just about everything Fonagy says. But that's one thing where I would say, actually, I think it's the second step. And here's why. Because if you go straight to validation, if you go right there and you don't do any of the looking inside work, what you often get when an enactment has happened, think about it. I'm in the space of feeling hurt by this client. I'm in the space of feeling like, wait, what's going on here? Wait, are you like, well, how can you accuse me of this? Or like, I'm being defensive, I'm feeling upset, if I try to validate in that mental space, it's going to be fake validation. And fake validation is something trauma clients are exquisitely skilled at noticing. So if a client starts crying and you're feeling annoyed, like let's say there's a client who's crying and they're really upset and you're not feeling sad for them, you're not feeling connected to them, you notice that you're actually finding this person to be fake and manipulative and all of that stuff. And what you say to them is, oh yeah, Susan, I see you're so upset. And it's fake. It's dripping with dishonesty and inauthenticity. It doesn't work. Clients will notice your lack of authenticity. And so the first piece of work has to be looking inside. Validation then becomes the relational first response, the response that the first thing you do with the client.
Is that what Rogers is missing?
I don't know. I mean, I think I don't know that it's missing necessarily, but I'm presenting it in this kind of way. I don't think Rogers would necessarily disagree with it. He didn't emphasize internal self-reflection. He emphasized empathy, but he's gone, so we can't ask him. I think that you do. Yeah, exactly. So this is why you need to look inside. You first need to ask yourself, how did I hurt my client? How did I activate my client? But then if you've done that, when you engage in validation, you have to stay. So here's some sort of guardrails for how to engage in validation. Stay in the here and now. Stay in the here and now. The worst thing you can do, the client says to you, "Dear Dr. Muller, are you kidding me? Would you talk to your children that way?" And I respond by validating him, in quotation marks, like this. "Dear Nigel," I email him back, "I can understand how upset you would be with me. Having grown up with a father who was very abusive and a mother who was not protective of you, you would clearly project your feelings of hurt onto me. And that would be very difficult for you. I recommend that you continue in therapy to understand your childhood issues and how your childhood issues have affected you." That would be a one-stop step to never seeing that client ever again. Would that be wrong? Everything I said there probably is correct. It's not wrong, what I said. It's not validating in the here and now. And so it's not staying with the person, it's not meeting the client where they're at. And so if you don't validate in the here and now, the client feels uncontained. But validation also is not collusion. So the goal is not to agree with the client. The goal is not to say to the client, to start sort of mea culpaing yourself. "Oh, yes, Nigel, I understand you're upset with me. I really never should have accepted those scones. I really am a terrible therapist." That's not good either. It's not about collusion. It's about understanding the client's subjective experience. So how does a good email response and then therapy session around validation look like with Nigel? Okay, so with Nigel, I had to validate him. What did I have to do? I had to recognize that at the end of the day, as embarrassing as it is, sure, I felt hurt by him, but I'm not proud of it. The way I reacted was to hurt him back, right? I mean, at the end of the day, this is what I did. And so my response, without getting too much into great self-disclosure, but balancing that with keeping safety in the relationship, I wrote to him and I said, in a validating email, this was my attempt to validate, it's not the only thing you could do, but this is what I did. "Dear Nigel, it's true. that isn't how I try to talk to my children. I hope you and I can speak about it. It seems something difficult and upsetting has happened between us. Dr. Muller. That's all I said. If I were to do it again, I might say, Dear Nigel, it's true, that isn't how I talk to my children, how I try to talk to my children. I hope you and I can speak about it together. Whenever I'm doing repair work, I bring in the language of together, that we're going to try to figure this out together. Like, you're not alone in this. It seems something difficult. Okay, so, and then in session, I continued to validate his hurt. So, when the email is sent, it's not game over. It's not like, oh, well, now email is sent, now he can come in and we can start really understanding him and the things from the past. No, if he comes in, if that even happens, he still needs to be validated in the here and now. I don't know, safety in the relationship has not happened. Now remember, we're only at step 2 out of 4 steps, okay? We're still pretty early on in this process. But in the session, so let me just say, I didn't know how he would respond. So I wrote that email, and his response was something like, small o, small k, okay. That's it, okay. That's what I got back, okay. And so then I responded to him and I said, okay, so I look forward to seeing you next week at our regular time. And got another small okay. All right, and he did come in, and the first thing to do is something very simple, like, so we had quite the week, I mean, like, a lot of stuff happened there, and you sent me this email, I sent you this email, how are you doing with all that? Just a simple question, and well, I was really upset, of course, and empathy and just staying with and being curious and listening. And I don't know where he's going to go yet, but just starting with some simple validation around, yeah, that was really hard. And when you got mad at me, Dr. Muller, that was like really freaky and weird. Like, for sure, I could see that. What was the freakiest and weirdest part about it? Well, just, I don't know, it seemed out of character. That was hard. That must have been hard. So just staying with, empathizing. We're still at only step 2. There's step 3 and 4 still. Okay. Questions so far? Yeah. Why did I email him back? I could have been a phone call. I could have called him. I mean, there's no necessary reason. I mean, I think for sure you could have called. If the client is in the habit of more of a phone callee kind of person, or I don't remember exactly why, but
Where he's at. I mean, he could communicate through email.
Yeah.
And, that's meaning where he's at.
Yeah, I mean,
Comfort in the relationship between you, could be protected and create a distance, and you can answer how you want, when you're ready to. Both of you with a lot of pressure to get, or potential for the pair session almost, which is not what you want, which also could add another layer of.
yeah. I mean, I could see an argument for both. I mean, I think the most important principle I would say is, either way, with either technology that you would use to kind of stay at that moment with the self-reflective piece around, okay, what was, like, so you will have done by that point some looking inside, and I would have done by that point, and I did do some, okay, I think we stepped into an enactment. Things have been going kind of off kilter for a while. I don't fully know what's going on, but I know that I broke some boundaries. I need to sort of kind of bring things back on track, and I'm going to be really curious around what's going on for him and what he was feeling, and not presuppose anything. So that was the internal work, and then the validation around his feelings. Let me, yes, last comment, and then I'll go.
Let's say suppose that he wouldn't have responded to your email. Would he have
I would have. If he wouldn't have responded after, let's say, a week, I would have This is a client, and I often get this question: how much do you reach out to a client, especially with a client who has? I talk about this a lot in trauma and the avoidant client. Very often, clients who have been rejected will use rejection as a way of coping, and it's not like it's just neutral to just say, well, they'll call me when they want to. They'll reach back out. No, that's not neutral. Because for trauma clients, the go-to is to feel rejected and abandoned. And so, his emailing, even with this email, I don't know what he's thinking. So I would follow up and say something that sort of invites. What I don't do is I don't pressure the client, but I'll be encouraging. I'll invite them, and so that's what the hope that I had with this client, that this was an invitation. I hope you and I can speak about it. I hope. So I'm saying that I'm bringing myself a little bit into the room, right? I'm saying, I have a hope. This matters to me. Without saying, you matter to me, which one could say, but I feel it's a little bit heavy-handed, or, I think, I hope. I like the word hope. Somebody during the break, you mentioned that sometimes with clients, when there's something that's going on, you might come back and say, I've been thinking about what happened last session and ... I love that. I think that's really, really good. I've been thinking about, meaning you, client, are sometimes on my mind. Wait a minute, I'm sometimes on the therapist's mind? Holy cow, wow. I would never imagine. I wouldn't think you'd ever think about me. Might be. It's curious. But I would only do that if it's true, if it's an authentic thing. I wouldn't do that as a manipulation. Okay, so we're at validation. Now, the third step is containment around the conflict. What do I mean by containment around the conflict? What I mean is, I'll give a name to what's going on between us. I will literally give a name to it. The word conflict is a word that some people really don't like, and if they don't like the word conflict, find another word, I'm not sure, but I find the word conflict is okay. Why? Because when you're at the level of a rupture, it does feel like a conflict. It's not, like if it's truly a rupture, if you've had a good therapeutic relationship with somebody, and now it's off kilter and the client feels betrayed by you, hurt by you, angry at you, misunderstood by you, you're in conflict with them. The issue is not that you're in conflict. The issue is that you need a way to navigate through this conflict. Well, you happen to know a way to navigate through this conflict. You do. The client doesn't. The client doesn't. So naming it really is helpful. So like as I say, even if you validate, and this is something that Roger didn't talk about, but even if you validate and give empathy, the client still has their back up a little bit. Well, wait a minute. You're being nice to me now, and you're understanding me now, but how do I know you won't turn on me like my dad did, or turn on me like this happened, or I can't trust you. You're a manipulator. You're a liar. That might not even be conscious. That might be totally unconscious, but it's there somewhere for clients who have trauma histories. So you want to name the conflict. And what that also does is it brings a sense of authenticity. It's bringing reality into the room. So it's not a fancy intervention. It's just something like, so Nigel says, I was really upset. I don't know how we're gonna, I don't know how to deal with this. I'm really upset with you. And I say to him, yeah, you really are. So that's the validation. Of course, yeah. You're really upset with me. This is a tough spot we're in. Nigel, I'm thinking that conflict like this, when two people care about each other and have been working together, conflict like this can be hard. That's all. That's all I'm saying. That's all I'm asking you to do, is name it, notice it, bring it into the room. Conflict like this can be hard. I might say to him,
It's like ground the relationship.
it's grounding it, exactly. I frame it also. So I name the conflict. I frame it as a conflict. I might say, Nigel, it's hard when two people care about each other to be in common. I might say it like that. I might frame it, I very often do frame it, as a relational process. So I might say something like, this is hard. What are your thoughts, Nigel, about how we want to address this conflict? Where do we go? And he says, well, I don't know. I mean, are you mad at me still? And I say to him, well, let's step back for a second. Like, it sounds like you're worried I'm mad at you. And he says, well, yeah, I mean, you seemed like you sent me that email that seemed like you were screaming at me. Okay. I'm hearing that I'm hearing a child part there. Okay. And I just say, yeah, that was really hard for you. That was really, really hard. And I think, as I think about it, as I hear you talking, I'm thinking, together, you and I will figure out a way to move through this conflict. How does that sound for you? I might just say it that way. So in other words, I'm reframing this as a relational process. I just might say that, and I'll see. I might say something like, this conflict is hard, but I'm thinking that together we'll be able to figure this out. Or I might say, so how do you want? So I'll use relational language. Let me... I think, yeah, you could, that this sometimes happens in a therapy. Why frame it as conflict? Because it explains what's not going on between us. So first of all, the reason I will use the word is because it's a conflict. It's a struggle. Something's happening here. But what this isn't the end of the relationship. This isn't betrayal or manipulation. This isn't unbearable. What it is it's honest. We are having a conflict. And conflict in relationships, if you've had arguments with your partner, if you've had arguments with your children, you love them, but you're furious at them, your child. Conflict is messy. It's difficult. Your child tells you that she hates you. You know she doesn't hate you, but in that moment, there's a part of her that does. Conflict is messy, and you have to figure out your way through it with this person who you love, right? And sitting with conflict helps people grow from the conflict. So that's why we really frame it that way. But it's something that can be challenging. And like I say, this is a way of containing the conflict, a way of containing the person's feelings and their anxieties about what this might be. Again, it's done quite briefly. Like, I'm not saying this is a big intervention. I'm not saying it. All I'm saying is that as I'm validating, I'm also throwing in there something about this is hard, and sometimes people worry that they're not going to be able to figure this out. When clients and therapists, this might be a normalizing thing I might say. I might say when clients and therapists get into conflict, that can be really scary. And so for us, figuring out how to navigate this, that's going to be kind of something that I think will be important for us. How does that sound to you, Nigel? So I might say something like that. Okay, and then we get to the fourth step. I want to make sure we have enough time, and I promise I will answer questions. After after initial work of looking inside, second step, validation. Third step, naming it as a conflict and providing containment around what's going on. That's when you get to, only as a fourth step, mentalizing. And so what does that look like? Like I say, it only happens after we look inside, validate, and contain. What does mentalizing mean? It means asking questions that relate to reflection, inviting the client to explore their motivations, And so Nigel agrees and says, yeah, I mean, well, this is weird. Like I've never had a situation where a therapist was mad at me before. Again, I don't know exactly if I was feeling mad at him, but it doesn't matter. That's how Nigel is experiencing it. And it's absolutely true that I was feeling something. I was feeling whether it was hurt or whether it was feeling competitive or feeling a sense of abandonment or who knows. Any of those feelings you might imagine a therapist in that situation might be feeling. What's important here is the client's words here and his projection is, well, it's so weird that, and I say, yeah, what's weird about it for you? Well, I don't know. It's like, I emailed you and you emailed me and I don't know, and then you emailed me that nice email and I'm just feeling really confused. And I said to him, yeah, it's really confusing, isn't it? I just sort of stay with him, kind of more, and he says, it's just so confusing. I say, like, well, what do you think was going on for you? What do you imagine might have been going on for me? So that's the mentalizing question. Very simple, very kind of fluidly done along with what the client has just said. And he said, well, I don't know, like it seemed like you were really, really upset. Okay, what's hard about, so I'm not going to right there, no, I wasn't really upset. Maybe I was, I don't know. I mean, what matters is his experience. What was that like for you? Well, I was worried. Okay, tell me what your biggest worry was there. I mean, I thought you were going to drop me as a client, honestly. Okay. And what was scary about that? Or I might say, what did you feel about that? What was that like? Well, it was kind of scary. And then we go on like that, let's say. I also ask mentalizing questions, about me, which is a strange kind of thing because it invites me into the room and invites projections into the room. So the client might say something like, you seemed such and such, and I might say, did I? Tell me about how you experienced me. What were you imagining was going on for me? Well, I did think you were upset with me. You were mad at me. Okay. What's the hardest part about that? If I was mad at you, if that was true, what would be hard about that? What would be, and then sort of exploring that again, having him imagine what was going on for me, imagine his feelings about what he imagined going on for me, and I don't know where this will go. But what I'm doing here is I'm adopting a curious stance, inviting the client to explore their motivations, what triggered them, what did they imagine might have triggered me. I'm wondering what's going on for you, for me. Bring in emotion. What were you feeling when ... What were you feeling, and then what were you feeling when such and such? What were you worried? Worried and hope is a really good kind of exploration question. What were you hoping that? What were you worried that? So I like using worried, hope as two sort of ends around questions that are around mentalization, around reflection questions. As you think about such and such, what were you worried was going on for me? What were you hoping was going on for me? As such and such was happening, what do you hope, how do you hope you would have responded differently? Because he says, I'm really embarrassed that I did such and such. Oh, how do you wish you would have responded differently? What are you worried it says about you that you responded in this way? So worried hope can be applied both to mentalizing yourself and to mentalizing the experiences of others. This is all about reflection, about self-reflection. And we don't know where this will go, but this is a process that allows rebuilding of the relationship. Asking, what are you feeling right now? I love this question. As we talk about this, Nigel, so we've reached a certain point, and I notice something nonverbal in him. As we talk about this, what are you feeling right now? And I don't know what he's going to say. Well, I'm feeling a little hopeful, but I don't know, you might blow up at any time. Oh, that's really interesting. That's really interesting. So there's a question, a little bit of trust, isn't there? Yeah, can I trust you? Right. Can you? That's a really good question. And I'm not going to say you can trust me. I'm just going to say, yeah. So I'm just going to hold it there, containment. I might also ask, in mentalizing with him, what about what I said? Here's a question I like to ask. What about what I said triggered you most? After reading what were you worried hope? How did it feel to finally tell me off? Like he did say, yeah, I did. I kind of felt good to tell you off, and I was able to be excited about that with him. What did that finally feel like to tell me off? Okay, so before we conclude with this, I'm going to read a little piece from the book, and I'm going to just say, unpacking conflict and trauma work is a process. It takes place in the here and now. It's always stirring, but when done well, it can bring about what's referred to as post-traumatic growth. So let me read you the last little bit. I promise I'll answer questions. We still have some time. You'll have to read the book now. In opening up discussion like this, we adopt a position of not knowing. We have no idea where precisely this exploration will go, how long it will last, or what will come of it. But if the therapist sets the right tone, noticing the enactment, validating, containing, the exploration can go on for a while, productively, with surprising discoveries. It's a discussion that can come and go when the clinician can bring back into the room when thematically similar or contrasting issues come up in the treatment. In the work that Nigel and I did, he realized on some level that he felt jealous of my kids. So as we began to do this mentalizing work, the issue of jealousy came up. This was initially embarrassing for him to admit, but embarrassing or not, it was inescapable. Would you talk to your children that way? Was the question he asked. This idea resonated for me. I felt like our boundary violations, I experienced them as more parent-child than anything else. I would come to realize my part in trying to make Nigel my special client. And while it became obvious to Nigel very quickly why he would want to make me his father, so to speak, and what hurt when I failed to fill that role, because ultimately you're going to fail to fill such a role, right? There's no way that that can actually be filled. What came weeks later was the connection to his own role as a father, how terrified he had been to have children to begin with, and how worried he was that now, with the troubles he had caused, his kids would be messed up for good. And later still, how he would decide to come clean with them. Yes, his kids already knew the truth about what happened. They had found that out months ago. The grandparents had told them. But he had never discussed it with them himself. There was a lot to say, and it was personal, about himself, about his family, how he had turned out as he did. His own children knew almost nothing of his past. To Nigel, this was no longer all right. But the discussion would carry risk. He had no idea how they would react, but he wanted my help to prepare. And we would walk through it together, not knowing how it would change the father he was or shape the one he might become. So that's the end of the chapter. Let me take questions. I will just say, as I mentioned, unpacking conflict and trauma work is a process that takes place in the here and now. It's stirring, but because of the opportunity to engage in a corrective emotional experience with trauma clients, it can really bring about post-traumatic growth. Okay, questions?
So first of all, I really like this breakdown of the steps involved.
Okay, good.
Unpacking conflict. Something that I was thinking about as we were talking about it is that just thinking about my own experience with clients and my supervisee's experience, I think this actually might be the easier thing to do sometimes, and the harder thing might be dealing with Nigel.
Right.
And you had your coffee and scones.
Exactly.
And he had his, and you were happy and his happy. How, I think maybe sometimes dealing with it then might be harder because you're shifting the status quo and the comfort zone and
Exactly.
deniability and shame.
For sure, and that's why I bring up countertransference before talking about repairing a ruptured alliance, because of course, noticing your countertransference, those are the questions you want to ask that can reduce the likelihood, anyway, of stepping into such an enactment. I mean, but the question is, as you pointed out in the first part of this talk, there are going to be clients where you will invariably end up in an enactment. And even the best, most thoughtful kind of therapist who has had therapy, we all still have issues. And we all, I went through 4 years of therapy as a graduate student. I found it incredibly helpful. And still have issues, as we all do. There was a book written by a Boston psychoanalyst. The book was called Fine, and in it, it's a comedic book about a psychoanalyst. But in it, he starts off the book saying, "Well, I'm a psychoanalyst, and that means that you should know that I'm a perfectly analyzed human being." And of course, as you can imagine, he's anything but the perfectly analyzed human being. But there is no such. I mean, what Samuel Shem is his name, the author, a Boston psychoanalyst. Anyway, he's playing with this idea of, we all continue to have issues, even, no matter, and that's it, becoming aware of them is really what we want to do. And so I agree with you 100%. When we are doing things, saying things, feeling things that we don't normally, really challenging ourselves to look inside and ask ourselves what's going on. I've gotten a 2-minute warning, so I'm just going to give you a brief little thing and just say there's a mental health resource called the Trauma and Mental Health Report that my students and I write. It is free, it is online, you can refer your clients to it, you can refer your supervisees to it. We've got all kinds of interesting articles, like for example this, Breaking the Cycle, Maternal Substance Abuse. They're 2-page articles that summarize to some extent research, but they're written in a very, very accessible format. And those are my book titles, Trauma and the Struggle to Open Up and Trauma and the Avoidant Client. Both are available widely. And then if you're interested in my parents' memoir that I mentioned before the break, From Hungary to Canada, the memoirs of Louis and Eva Muller. They were both Holocaust children during the Holocaust, and I worked with them, interviewed them around their history, and the traumas they went through as kids. Final questions. Let's see, I think there might be a couple more. Yes, in the back.
You started out by talking about self-disclosure. I can imagine in that conversation a client pushing you, what were you doing? What were you doing?
Right.
So, did you keep redirecting away from it?
Well, it's so again, less redirecting away so much as providing what needs to be provided so the person can feel safe. And so, exploring with him, what did that mean to you? What was scary about that for you? What was hard about that for you? Well, I was worried that, okay, and where does that worry take you? Well, I don't know, like sometimes so I don't know. Most clients don't, like by simply engaging in the process of exploration, most people come to a place where they feel that you are safe again, that the relationship is safe again. And I don't find that they need a whole bunch of details about me. What they need to know is, what needs to happen is recognition that what they were picking up on wasn't crazy. So the client, you're thinking about lunch, let's say, and you're not really paying attention, and the client thinks you don't care about them, and they call you on it the following week. I think it's okay to say, you know what, Judy, I think you're raising a really good point. I'm thinking back to when you were talking about that, and I was distracted, actually. What does that mean to you? What's that like for you, for me to say that? And bring it to them and see what it means to them. And I find that very quickly clients will explore that and won't need to hear tons of the details. So, what's that? I would, if necessary. Like if that's what the person needs, yeah, I would. Like I'm not against. It's interesting. The next talk, the bridge to the next talk. So at 2:00, I'll be talking about forgiveness in trauma therapy. So it's called Forgiveness: The Double-Edged Sword of Trauma Therapy, and in it we talk about apology and forgiveness in treatment. So. Final question, Rosie.
Just going to that question, you made a statement, and one of your statements was that how are you feeling now?
Yeah.
I find that from Dr. Muller's work, as I'm exploring how it was, and I thought, how are you feeling now? The client generally has processed through the whole thing.
Through the, yeah.
Generally, the client comes, I'm feeling okay. I feel you're safe now.
Yeah, they feel better, yeah.
Come to that.
Yeah, I agree. Let's stop there. If there are any more questions, feel free to come on up. And thanks so much, folks. Yeah. So, feel free to come by this afternoon if the mood strikes you at 2. Different room. Yes. Yeah. Okay. Oh, thank you. Thank you. Yeah, I've got a little bit of... Okay. Let me make sure this is off. Actually, let's turn the microphone off here. Sorry.